All right, well, let me welcome everybody to Marquette University Law School in Eckstein Hall. I'm Mike Goucher. This is On the Issues. This is our continuing series of conversations with news and policymakers, people who are doing interesting, important work in this region and beyond. And today we are joined by Vanessa Tobin. Vanessa is the Senior Technical Advisor for Water Supply, Sanitation, and Water Resources for Catholic Relief Services. Until December of 2011, Vanessa led all the activities and functions of UNICEF in the Philippines. She worked at UNICEF for 24 years, also serving in Egypt, Nepal, and Pakistan. Won't you please give Vanessa Tobin a warm welcome to Marquette Law School. As most of you know, Vanessa is here as part of Mission Week here at Marquette University, and today we're going to be talking about water as a global issue. We'll talk about supply, sanitation, sustainability. It's an important issue and one that Vanessa cares dearly about and has worked much of her life to address. So let me begin by first saying thanks for being with us. It's great to have you here with us this week. But let's begin by talking about your work and Catholic Relief Services work on the issue of water. What are you doing?
Catholic Relief Services is in about 40 countries globally, working on rural water supply and sanitation, also urban systems. Good example is Haiti, where we've been heavily invested since the earthquake in supporting urban water supply and sanitation. A lot of our work is working in the most poorest communities. These are simple, low-cost systems that we're working on, and we work very closely with governments to install, and we also work very closely with local non-government organizations, and particularly also with church groups for the mobilization and social work that's done at the community level, and on health and hygiene education work.
Give us a sense of the work is certainly about improving health in these areas, but how much of the work is really about social justice, about this being a moral imperative?
I think a good example is my visit to Democratic Republic of Congo last May, going out to an area, Kasai Oriental, Loja, where CRS is very active, as is Caritas. Going into villages where you're going along roads, there are no roads, there are only dirt roads. These villages have never had a water supply system. These are very, very poor communities. Going to see where they collect water, heavily contaminated, heavily polluted sources that children are playing in, that women are collecting their water from, and where they're going to wash. And that polluted source is more than a mile from their village, more than a kilometer from their village. So the implications in terms of access to these poorest communities that have never had an improved water supply system, and what we take in the United States, the United Kingdom for granted, that we have water in our house, that we have access to sanitation. And whenever, as we all know, that's cut off for one day, 1 week, as it was during the Hurricane Sandy, you really do experience what most people in really poor villages are still experiencing, because most of the people that don't have access to water supply are the poorest people in the world.
Let's put this in perspective for people in this room, because you touched on this. I mean, we live on the shores of Lake Michigan. We're a part of the Great Lakes, the largest Great Lakes freshwater supply in the world. We're used to fresh, safe, plentiful water, but safe, fresh, plentiful water is not a given in many parts of the world, even today, even in the 21st century. Where is the problem the greatest?
Right now, there's been a lot of publicity for the Millennium Development Goals, as everyone may be aware. And the goal on water supply and sanitation was to reduce by 1/2 the number of people that don't have access. And since 1990, 2 billion people have received access to water supply. There are about 750 million people in the world that still don't have access. And the majority of those live in rural areas. 7 out of 10 are living in rural areas. And most of them are the poorest. But even taking an examination on that issue, we've still got more than around. Well, there's about half of the world's population has access to a tap stand within their house or compound, but there are still 3 billion people that don't have access to a household connection. So when we talk about access and the 2 billion people that received access since 1990, we're talking about providing 20 litres of water at a distance of 1 kilometre from the house. In Ethiopia, it's 1.5 kilometres from the house, and it's 15 litres. And to think that if we were to have to walk even 1 kilometre to collect our water, that's still extremely difficult. And that's the basis of access that has been provided over the past now 25 years.
And a couple of weeks ago, you and I were talking about this. Access is one thing, but there's a difference between access to water and access to safe water.
Yes.
It's different.
Yes. The definition, as has been supported by everyone, has been based on clean water. It has not been based on safe water. And one of the major questions that will be examined at the end of this year globally will be how does one ensure that water is safe? And the risk of microbiological contamination, diarrheal diseases is still one of the major killers of under 5s globally.
How many children die from diarrheal diseases?
We're estimating around 2 million children die a year from diarrheal diseases. Wow. So it's still very, very high. And so, and it is one of the major killers in under 5s. It also contributes significantly to stunting in children. So in terms of prevention of water-related diseases, there is a direct connect between diarrhea and malnutrition and stunting in children, which is highly prevalent, where it's considered that about 30% of children in developing countries are suffering from stunting.
And let's talk again about the regions of the world where these problems are particularly acute. Where are they?
The biggest challenge on water supply and sanitation has been in sub-Saharan Africa. That's where the targets have not been met. That's where countries have lagged the most, both for water supply and for sanitation. But if you look at the absolute numbers of people that are not served, the most numbers of people not served in sanitation is Asia. Because India still has not accelerated significantly its coverage on sanitation. And it still has about in the region of about 600 million that do not have access to sanitation.
Isn't that interesting? Because I think we think of India today as being a nation that's on the move, that many very positive things are happening, but sanitation, water, still big issues there.
India has issues of disparities. Mm-hmm. In the south, there has been progress on sanitation. There's been mobilization of NGOs that work closely with government. The north has had many challenges, both on water supply and on sanitation. A state like Uttar Pradesh is probably one of the largest countries if you took it for population. But in terms of access to water supply and sanitation, it's much lower than the national average. And the areas of the north of India are the poorest areas. And that's why many development agencies, the government of India, making a lot of effort and progress. But sanitation is still a major challenge. And a lot of the challenges around sanitation are cultural and social. People do not give it the same priority they give to other development areas, such as health, education, water even. It gets a lot more priority than sanitation does.
Why is that? Why does sanitation not rank higher in terms of priorities?
I think a lot of it is people, we take it for granted. Yeah. We take our sanitation and our hygiene for granted. We automatically wash our hands. This is ingrained into us the minute we come out of any facilities, before we eat. These are luxuries in many countries, because if you're going to even give 20 litres per person per day, and bear in mind for that 20 litres they're still carrying buckets of water back and forth, they're very careful about what they use that water for. So using it for hand washing, as many times as we consider important, may be considered a luxury. And hand washing alone will reduce diarrheal diseases by 40%. That's Lancet's data. Same with acute respiratory infections. It can reduce that by 30%. So we know it's one of the most important interventions in development is hand washing. Mm-hmm. But you can only wash hands if you have enough water.
Some nations, for example, in the continent of Africa, are doing better than others. Why is that? Is it about the politics? Is it about safety? What's going on there?
Ethiopia has given a very high priority to the Millennium Development Goals, and there's been incredible progress on under 5 mortality and the reduction on under 5 mortality. They've also mobilized the government around the water supply goal, and so there has been progress. There's been a lot of momentum and energy that's been exuded there to reach the targets and reach the goals. Other countries have taken on the MDGs in a large way. Zambia has made some really good progress in terms of water supply. Most countries in Africa still haven't made the required progress on sanitation, but there has been great developments in terms of the support and energy around accelerating access to water supply. The difficulties is sustaining the gains. If you take, for example, in Ghana, 30% of those systems are no longer functioning on the water supply side. Ethiopia did a national inventory of all of their water supply systems and found that 30% of them, and this was government-led, 30% of them were not functioning at any one time. So you have obviously the challenge of providing the water, but you have the challenge of ensuring that those services are sustained. This isn't a one-off project. It's a project that's very much connected to government, to both central and local government, to NGOs, to communities, to donors, and that circle to be properly energized and continues beyond the end of the installation of a water supply system.
Yeah, so the risk here is that we feel like once we've installed a water supply system, problem solved, we're done. But you have to maintain it, and you have to keep going back to it to make sure it's still functioning properly.
And the challenge in sub-Saharan Africa is, too, that they've, over the past 15 years, since the Millennium Development Goals were declared, there has been a dependence on importation of technologies. And many of the water supply systems that are constructed are imported from Europe or from India. And the cost of those systems are 3 times what they would be if they were installed in India, or 4 times. And that dependence on importation of supplies and equipment has led to problems in supply chains and the break in supply chains because of that.
How much of a factor is political stability in some of these countries in terms of addressing water issues?
Some of the greatest difficulties are in countries of conflict. That's where the coverage figures are the lowest. 2 good examples are Democratic Republic of Congo and South Sudan, where water supply coverage are at the lowest rates, and going into some of those areas poses difficulties. I was incredibly impressed by Loja, where CRS and Caritas had offices, had both incredibly dedicated national staff and international staff working there. Conditions were very, very basic. There was no electricity, generator for 3 hours in the morning, and there was local strife, local conflict. It wasn't against any of the offices or any of the personnel, but there was local conflict. And there had been a conflict in February, and the office staff had left for a couple of weeks, a month or so, and then immediately went back to continue working. South Sudan, there are areas and pockets that are quite difficult to work in, of the areas where CRS is engaged and other agencies, UNICEF and others are engaged. And they have, obviously there is a high level of security that has to be taken for staff and personnel moving. And so it's really important to secure that, but it's also important to reach people who are in the greatest need. And conflict countries tend to be where people are in the greatest need. I think there's no question that it's shown very clearly that development is better where there is good governance across the board. If it's water supply or health or poverty alleviation, it's where governance has been better.
A quick aside on this point about the safety of your people and people who do the work in these countries. Is it hard finding folks from Catholic Relief Services who want to go to some of these countries where the political climate is a bit less certain and where there is some element of danger?
it amazes me to see and to go to places like Loja, but also looking at CRS's response to the Ebola crisis. CRS was inundated by volunteers from its own staff to go into Liberia, Sierra Leone, and Guinea to help on the Ebola crisis. Nobody was not willing to go forward to assist on these countries. There is an amazing program in CRS, the Fellows Program, where people are taken in that may have a certain level of experience, and they're trained by working in areas. One of the fellows was in the Loja office in Congo, where they receive a training for a few years, and they really learn about CRS, and then most of those fellows are engaged in programs, like the head of programs for the office was a former fellow. And so this is a competitive process, but it's incredible because these people are very dedicated, very motivated, and this has been a lifelong dream for most of them to want to go and work in a developing country, working on projects where you can see so much happen.
You've said it was a lifelong dream of yours, that this is something you had thought about even as a very young, as a girl and a young woman.
I was 15 when I decided I wanted to go overseas. I wasn't quite sure how I was going to do it, but luckily avenues and paths opened up for me. I think now I'm less wide-eyed and obviously bushy-tailed about looking at development issues, but I would never call me cynical. I think you have to be amazed by the progress that's been made. When you look at how much has been done on immunization in countries, on child mortality, on water supply access, on agriculture and productivity in countries, on poverty alleviation, there are great results. In Africa, there are great results. If you look at the world and how it's mobilized itself in 6 months around the Ebola crisis and what the United States has done to help on the Ebola crisis, what all countries have done, I don't think there's a fatigue. I think there's a real desire to help as much as possible. And we're much more interconnected now than we ever were before. And we saw that with Ebola, and we see it with crises. And the world is so much more interconnected through media, through transportation, through all forms, and therefore that knowledge and that interconnection, I think the United States is far more conscious and aware of issues in Africa than they probably ever were before.
In addition to the U.S., and who else is playing a major role? Which countries around the world are playing a major role in the development efforts in Africa, for example?
Well, it's not because I'm British, but the United Kingdom has invested very heavily in development in sub-Saharan Africa. They actually invested very heavily in Asia as well, and still are. And they're one of the largest donors on water supply globally. So they've been a great supporter of water supply and sanitation programs and capacity development, not just installing systems, but ensuring the money has been invested in capacity development. Other examples of great development progress in the Netherlands, that's been heavily invested in development, poverty alleviation, water supply, sanitation, health. Japan, that's been very engaged in development issues, and of course the Scandinavian countries that are very heavily engaged and invested.
Are you satisfied with the sense of urgency on the part of the global community to address the water issues, especially something like sanitation? Do you think we're doing enough? Or are we somewhat disinterested as a global community?
I think it's got to be more connected with health. I think that I don't think we realise that the largest source of danger in a community is the actual, and let me go into the details, it's the excreta of under 5-year-olds. And the reason for that is that's where under 5-year-olds are the most sick. They have diarrhea, they'll have worms, they'll have pathogens. Sorry to go into all of the details. We take this for granted that we're disease-free. We take this for granted. But we don't realise that in many countries, particularly in poor communities, 30% of the children may be suffering from helminth infections, which doesn't just affect their health, it affects their nutritional status and it affects their ability to learn while they're at school. And it's a waste of economic resources. So this whole, the health aspect, but under 5s are even more dangerous. Their excreta and other children can become infected when it's lying around household compounds, when there is no means of properly disposing of that. And of course, if the mother is not using a sanitary latrine herself, then the risk of infecting her children goes up dramatically.
And yet we seem to, that goes back to my urgency question. This is a reality, and yet, it's slow to change.
CDC last November issued a news bulletin saying that human excreta was the biggest threat to public health in developing countries. I think the health world, The Lancet, focused on this 2 years ago and the importance of addressing sanitation. It really does require, for the next set of global goals for all donors and for countries to prioritize this as top priority. In Asia, they're starting to do this, but the progress is still slow. So, and it's also because convincing families to change becomes difficult. But if it's given priority at the top levels, it makes such a difference. If governments give it the top priority, if the donors give it the top priority, if they intersect sanitation with health, and they make it a top priority under the health agenda, then it will happen.
Take us into a situation where you're communicating with people about changing the way they live. These are fundamental changes, things that in some cases people are not used to. They simply have not known. What is their reaction when you try to change behavior over time?
If you go into a community and you talk about sanitation, there's a resistance. Because there are so many competing priorities that people need to spend money on. There's agriculture, there's health, there's water supply. So to go into a community and talk about sanitation blind will never work. If a community has received a water supply system, if a community has benefited from an agriculture program, if they've already developed a confidence in program staff, then they'll be open to talking about other development issues. The other point is addressing men on sanitation issues. Their needs are different from women. Most sanitation options, people build toilets for the reasons of privacy and convenience. They don't build them for health and health benefits. They build them for access for women so that they have the privacy, particularly in Islamic countries, and also for convenience, so they're not having to go out to the fields, and particularly late at night. And also for young girls, for privacy, this is a major factor. So when one is addressing issues of sanitation and hygiene, convincing them is finding those motivational points that will then lead to interest, keen interest in doing something, and then conveying that, and all fathers want to look after their children. They want to protect their children and girls. So finding those motivation factors and working on them are incredibly important. And that's what's helped on many of the sanitation successes that have led to better uptake, increased latrine construction, have been, and it's been continuous interaction. Another aspect that's helped on the sanitation is the focus on water, sanitation, and hygiene for schools. Focusing on primary schools and preschools. So because children are magnificent at bringing home messages and reinforcing messages, and the importance of not missing children who are, of course, the next generation that can make a difference and do something. So this is one of the largest drives for CRS, is the work around washing schools, and also actually at health clinics, health facilities too.
Let me open it up to questions from the audience here in one moment, but I wanted to ask you a personal question about moving from UNICEF, where you worked 24 years and you had a lot of important responsibilities with UNICEF, and you moved to Catholic Relief Services. What was the impetus for the move, and what do you derive professionally from the work you're doing today?
When a good example is when I went to Congo and actually to Ghana and going out in villages, I actually spent a month in Congo, and it reminded me of my time when I had spent 2 years in Nepal living in villages. And it gave me a chance, because sometimes with all the work and all that we're doing, we forget the basic issues. And we can sometimes, and having that time to really be reminded of them, is incredibly important. I was very privileged to have 24 years working with UNICEF. This is an organization on the ground. It does magnificent work, and it really does focus on poor children. I've also been incredibly lucky to work with an NGO that I highly respect in terms of the work that it does in the field, looking at the motivation of the staff, looking at an area like Locha, looking at the areas in Ethiopia where they're working, in Tigray and other areas in the south, incredibly poor villages where CRS is working, and staff on the ground. UNICEF works closely with NGOs. CRS is one of the NGOs it works closely with. And there's no question that the role of NGOs is pivotal, working not only with local government, but also with small entrepreneurs, small businesses at the local level that really make the difference. And CRS is doing that. It's doing that through its work on savings and loan systems, its work on agriculture, as well as its work on water supply, is really developing local small entrepreneurs and really working on them to such a great extent. So it's so great for me to get back to much more field work.
Sure.
And as you get older, the less you really want less paper, less whatsoever else, which is incredibly important, and every agency has it, and we respect it and we know it. But it's really, really important to keep always your feet on the ground, going out to the field, seeing what's happened. And I also did that with UNICEF. In the Philippines, I was out 2 weeks of every month on the ground. And I can honestly say that the staff that they have at country offices too, they're incredible.
Before we take questions, there is one thing that I wanted to ask you about. You have spent some time at the Global Water Center during your visits to Milwaukee. How can Milwaukee play a role in terms of improving conditions in other places around the world, based on what you've seen? 2
weeks ago, I came for the first time to Milwaukee, and I'm always excited when I come to a new city in the United States. I love the United States. And I was a little skeptical about what the Water Council could do, because there are many water councils in many places, and would the Water Council be able to make the type of linkages that are necessary to have a real global role and make a difference in developing countries? This morning I met with Dean Armhouse, who's the head of the Water Council, and I have to say that we are very enthusiastic to work with the Council. From Dean's vision of where the Council is going to go and what it's going to do, he's very much focused on innovation. And this has been a missing word in the water.
Innovation.
Innovation has been missing from the water and sanitation sector. It's been there in the health sector. It's there in education, but it's been missing from water and sanitation. And Dean very much wants to develop new technologies, but he also wants to ensure that they're monitored so that one can persist in ensuring that the technologies work. Because innovation is magnificent, but it will not work if there isn't the monitoring and the adjustments made to those technologies on the ground. So right now we're looking at a water pod technology, which is a simple water treatment unit that can work for about 750 to 1,000 people, can be put in peri-urban areas to get the necessary support for it. It's being developed with the Water Council to test it in the Dominican Republic, test a few units, monitor them through CRS, and make sure that we can make the adjustments to the technology. But the Water Council is invested in working with Veolia, with various companies, with Wells Fargo, with various other companies that they have housed at the Water Council. And we're looking at ways and means of working with them on innovative technologies for sub-Saharan Africa. There's also a company, and that name has eluded me, a metering company that we're very keen to work with them, that will look at water. Badger Meter. Mm-hmm. Sorry about that. That was the name I was looking for. You'd think I'd remember it. So Badger Meter is very keen, and it's very important because water metering doesn't happen in most countries. And so what's happening is rich or better off people are paying hardly anything for water, and the poorest are paying, like in Sudan, 30% of their income to water vendors for water. But if we can meter water from improved systems, then people pay what they use regardless. And that will change. It will mean you can subsidize also the poorest families and help them. They'll still pay something, but they'll pay less than 30% of their income. So working with Badger Meter and others and looking at testing metering, water metering in countries is something that will be pivotal to work with the council.
Vanessa, is there a role for Marquette University in any of this?
Today we talked to Dean Amhouse about working on an agreement with both the Water Council and Marquette University and CRS to look at innovative technologies in sub-Saharan Africa, a role for all, and where also students can document the process, get engaged in the process, and that we have the means to test, innovate and change accordingly on the technology side. And then from there to develop a joint proposal between the parties that we can take to foundations and seek funding on.
So this will all move forward in the months ahead, you hope?
I hope so.
Things take a little time, but it sounds promising.
Yes, I think there's a real commitment. I think we really, as I said, I was a little, I'm always, and I think I would...
It's good to be a bit skeptical.
Yes,
a bit.
To stand there, but with anything, and this is where I think the word innovation, if you look at the innovations that have made a difference, they were never successes initially, never. They were only successes after they've been tried and tested over time, and that everybody had ironed out all of the problems with those innovations. And even now and then, there's always issues that will come up, but to me, monitoring is the pivotal word. And anything can be new and innovative and can be successful if the modifications are made and the investment of time and energy on monitoring is made.
So here's my final question, and there was a popular book a few years ago, The Big Thirst, written by Charles Fishman, and he says in it that, what does he say about water? He said, we love water, it's just that at the moment we don't appreciate it or respect it. Has that been your experience, or is that maybe a little too cynical?
Let me say something that's been magnificent about the United States. The United States in 2005 passed the Water for the Poor Act, Paul Simon Water for the Poor Act. And it was taken up across the board by both Republicans and Democrats who fought for that bill. And that bill made such a difference to the United States and its investments in water and sanitation. It developed a strategy. It was launched by USAID last year. It placed an undersecretary in charge of water that reported to the head of USAID. And December the 19th last year, a new bill was signed by President Obama, Water for the World Act, which alleviates water even higher on the political agenda and development agenda. And it means their State Department will also have an undersecretary, will have its own separate strategy for water, and will prioritize water as a major issue for the United States. It will also increase its allocation to the poorest countries. So there's always times when you can look and think, there isn't enough progress. This is, why are we wary? I think the important thing is to always state what the situation is. With the achievement of the MDG, it's still major work that needs to be done. This is only a small victory in 2010 to half the number of people without access, when we still only have half the world's population of access within a household, within their household. And 20 litres is not enough.
All right, let me take some questions from the audience here. Please raise your hand. I'm going to ask you to speak loudly today because our microphone system is down in here, except for us, which is a good thing. But please, if you have questions, raise your hand and we'll take them. Go ahead, please.
You talked a lot about what the state can do, what countries have done. What individually, what as a person every day can we do to make a difference in this effort?
Everybody hear that? What can we do as individuals to make a difference?
Well, you could support CRS. Actually, seriously, we're very invested in many countries. There are 40 countries. We work closely with partners. We're putting in simple systems. We don't implement directly ourselves. We work with local government and local NGOs, partners. But we really are working in areas and villages that are difficult to get to and difficult to access. I think the other areas that most people can really support is really is supporting issues of the aid budget that is invested in Africa, that continues. The difference that it's made, the US investment, the US ambassadors to the UN went out to Sierra Leone and Liberia and Guinea to support the efforts, put more investment into those countries. I think to support that investment is really, really important, because everything now is so interconnected, and so it impacts. And to support the fact that there is still considerable support that's needed for Africa. The other side, which is incredibly important, is the investment of the private sector into Africa. One of the most important aspects will be, over the next 10 years, is how the private sector develops in Africa. And that work with with companies in America, with local companies in Africa, those partnerships make a big, big difference. We talked with a company in Oklahoma that makes pumps, how we could forge a partnership in Ghana for local production of parts, supplies and equipment, and how we can develop those types of relationships that really help in all ways possible. So I think to be aware, to keep oneself aware of the major issues that are out there, which I'm sure by definition of coming here, you're already very interested in those issues, and keeping up to date with some of those issues and knowing about them. And obviously, CRS has a website, crs.org, that one can become more aware of issues around it. There are some good water websites. UN Water has a website that has statistics on water, all of the relevant information there as well on it. And the USAID has a web page that it updates on water supply and what it's doing on it as well. So I think keeping up to date on all of these issues, but also any way and means that you can. There are also other really good NGOs out there too that are doing good work, and UNICEF that's doing excellent work on water supply and sanitation.
Mm-hmm. Other questions? Let me go back here. Yes, sir.
You touched upon it briefly. Clearly, it's been more discussed in Europe than in the U.S. The issue of water as a right versus water as a commodity. And in these developing countries, without a strong government, how do we ensure that rich people end up owning all the water and impoverishing others?
And that's why the goal was set, not to increase coverage, but half the number of people that do not have access. It was shifted from the previous goals to focus on that. And the monitoring of that hasn't just been done by papers, it's been done by survey. You've had household surveys that were conducted with the support of the US government, the support of World Health Organization, UNICEF, to verify figures on water supply coverage, to see if those targets are being met. And the problem is we're finding in Africa that it hasn't been met as it should be. Now, a couple of years ago, the UN declared water as a human right. And that took years. That took years to come through. And now there's a special rapporteur for water supply. That was not the case before. But there is the belief that water as a right means you don't pay anything. This is how private sector interprets it occasionally. They interpret that if we are taking it as a human right, we're saying people do not have to pay. That was never the case. Declaring water as a human right does not mean that people do not contribute for water supply services, but it does mean there's a responsibility on behalf of governments to ensure that everybody has access to clean water. I mean, the fact that they still don't is just mind-boggling, that people do not have this, that they have to go to such polluted sources and use that water, and the dependence of doing anything when you don't have that, trying to educate the community, trying to provide health services to a community, trying to work on local small enterprises when they don't have, they have to go to a pond and collect filthy water.
What are the consequences, if I might ask, for nations that don't do this well? I mean, if you can see them that they're clearly not achieving their goals, that there are problems in the way this is all being done, are there consequences?
I think one has to be careful of not making too much around goals on the blame game. because some of these countries have terrible difficulties in reaching those targets and reaching out to them. But if countries have the financial means and resources to do it, and those countries are certainly prioritizing other areas, then their major questions will be asked, I think, on reviewing this to examine why they're not addressing these issues significantly. And I think the mobilization of all of the major donors around water supply issues, which is getting stronger, I think there is going to be far more questioning. And where it will make a difference, which is incredibly important, is any new funding coming into these countries. If 34 or 40% of their systems are not working, they're not investing their own resources where they can, then their chances of new funding coming in on water supply is going to be limited.
Let me take other questions. We'll go right here. Yes.
Taken by surprise, United States with the measles outbreak, something that we thought wouldn't happen again. I'm wondering about Anna's 2005 monitoring of water for the poor. I'm wondering, in the UK and the USA, since we've also seen a lot of monitoring of all sorts of things fall off the face of the earth, what are the conditions for our poor in those in your country and ours?
You put a lot of questions in there. The first one, on the issue of immunization, I had the good grace to also work on health for a few years. And I worked very closely on immunization programs, so I can't say enough about the importance of immunization programs. CRS is actively engaged in supporting immunization in countries, and it makes an incredible difference. It's been one of the major breakthroughs in reduction of under 5 mortality globally. So I can't say enough about how important it is that the United States and all countries continue to reach high levels of measles coverage. And, of course, the other antigens as well. Your question in terms of really keeping momentum up, the monitoring, does it really continue? Does it really get the attention it needs? Is it true monitoring? Correct me, I think that's where the question is. I think there's a lot of energy and attention on monitoring. I wouldn't say all of it is excellent. I would say that the important thing is to ensure that surveys are conducted at community level, to go into communities across the board randomly, using a good sampling frame that you're actually able to verify do we have a high immunization coverage? Do we have a water supply system there? What is the sanitation coverage? And that's what's been used for the goals. I can tell you that on CRS, one of its most sophisticated areas is its monitoring, and uses a high level of, even in, what was amazing for me is I went into one room at the office in Loja, and there was iPads everywhere being charged. And all of the staff in the other room were going in and out, checking the iPads and the data. And I thought, well, you can't run that. You can't run that in the middle of Loja. How's that going to work? It works. And all of the staff are out with those iPads collecting data from the project areas. I mean, to me, it's incredibly impressive. And I'm sure CRS isn't the only NGO that's been heavily engaged in setting up systems on monitoring. They work. One of the best systems on monitoring has been SMS texting, on just simple messages that verify is something actually happening. If that village has been listed for a water supply system, it's actually going in, and somebody out there SMSing in, system not functioning, not working. These are the now in this day and age of data, there's no excuse for not being able to collect data very, very simply. Mobile phones are everywhere in sub-Saharan Africa. This information can be collected. The importance is how it's being used. Is it feeding into government? Is it feeding into political levels that they also pressure government to take action on it? There's massive data out there now, but how it's being used is the major question.
Let me take other questions. Yes, sir.
When you start talking about water, you immediately start talking about sanitation. Obviously, sanitation is a very important aspect of how you have clean water. When you go into different areas to look at setting up water systems, do you ever put any type of requirement on the community that they start working on sanitation as a need before the system goes in, or do you just work on water and then hope sanitation follows?
I can go back 30 years on this. Nepal. I lived in Nepal. After I finished as a volunteer, I worked for UNICEF there for 3 years. And we made it a condition. You have to build 10 toilets with the water supply system. I went back when I was at London School of Hygiene and I surveyed those toilets. And many of them were not continued to being used. I think when you put conditionalities, you have to be careful, particularly on sanitation. Sanitation requires a high level of interaction. And if you start putting conditions on why people should practice sanitation, they might use it for a year or two, and they may not use it after. And the other factor, which I found from the work with the London School, was the toilets were not kept clean. And if they're not kept clean, there's no health benefit. And when we actually looked at diarrheal disease rates, we looked at those that had a toilet and those that didn't have a toilet. No difference. But when we then extrapolated the data of which toilets were clean and compared the families of the clean toilets, the hygienic toilets, with those that either had no toilet or a dirty one, we found significant difference in diarrheal disease rates in mothers and under 15s. So to me, that was it was a good indication to get very early in my career of how sanitation needed to be addressed, and that sanitation it's closely linked to hygiene, far more closely linked to hygiene. You need water to be able to practice good sanitation, and I worry when campaigns forge forward on sanitation and construction, and they divorce it from hygiene, because if those toilets are not kept clean, if they're not maintained, if families are not practicing good hygiene practices with it, there are no health benefits, very few.
Mm-hmm. Other questions? Yes?
You just kind of addressed a little bit of the question I had. In looking at technology advancements, innovation, micro-entrepreneurial work, there's a lot, I think, on getting clean and safe water. Is there that same balance with the sanitation, or is that viewed as a government infrastructure world that we haven't intersected yet?
There is a large initiative at the moment. It's called Sanitation and Water for All. The last meeting of that was last November, and it was chaired by the World Bank. And it was actually at the World Bank headquarters. And it's actually brought in ministers of development and ministers of finance to the World Bank headquarters to commit for sanitation and water, and in that order. So I think there is a lot of pressure coming to bear on sanitation now. I'd like to see the health sector in most countries even raise it further up as a top priority. I'd like to see all development agencies that are heavily engaged in health to raise sanitation as a top priority. But I think the momentum is coming there. And when the World Bank chairs a meeting and asks ministers of finance to commit, I think it's starting to get there.
Mm-hmm. Other questions? Gentleman up here. Come down.
You mentioned that CRS is doing water in 40 countries, and CRS is active in over 90. How, number one, how do they prioritize and select those countries? And number two, relative to sanitation, particularly when you have success in one country, understanding cultural changes and differences in others, are there ways within the process that you take success from one country, spread it in that country, move it to another?
On the first question, those countries where we're working are the most difficult countries that we're engaged in. They're the countries with the lowest water supply and sanitation coverage levels, and also where they have high under 5 mortality rates. So, for example, we're heavily engaged in Ethiopia, DR Congo, Ghana, Malawi, Madagascar, some excellent projects. We've prioritized our countries in sub-Saharan Africa because that's where most of the coverage levels are the lowest. We've had some incredible progress and successes too in Latin America, Honduras, Guatemala, and Nicaragua with the support of the Buffett Foundation. And we've also had a lot of work that we supported on emergencies in Pakistan, the flood response, India, North India on flooding. So we've been heavily engaged in emergencies on water supply and sanitation. We're also inside Syria on water supply. and working closely, I conducted a training on water quality monitoring in Turkey about 6 months ago to support the national team that were moving in and out of around Aleppo and other areas inside Syria. The issue of transferring what we're doing in one country to another country, across the board, CRS is we're heavily interconnected. We have incredible staff out there, and a good example is right now we're moving staff from Latin America into Ghana and other countries to exchange information about what we're doing, particularly on low-cost water supply and sanitation. We also, when we have short assignments, and we have a need right now in Benin and Togo, so we're bringing staff from other countries into Togo and Benin to work on water and sanitation for schools, and also a whole assessment of where we want to invest in water and sanitation in Togo. So bringing staff between countries is important, but it's also bringing project staff, not just CRS staff, but people that we work with in local government, other our local NGO partners, that they have the chance to move around. Also, even within a country, you've got a country as large as DR Congo. We have projects in the south in Katanga that need to get up to Loja and vice versa, where there's different things going on in country that there needs to be a synergy and exchange on. And that is something that our offices are heavily engaged and working on.
Mm-hmm. Yes.
I'm just trying, when you talk, I can hear industry and governments and global agencies, but I cannot have a clear idea what's happening at the local leadership, what's going on those
Right.
villages. And second thing that I'm trying to imagine is water is a gender issue, because who is in charge of those 5 years old? Who is the one who's carrying the water? Who's the one, like in India, that are more on their threat issues or safety because the lack of sanitation? And at the same time, what CRS can do to change the conscience about water affects mostly women in these countries. And I may be wrong, but I think that there's a very strong gender issue into this access to water.
I'm glad you asked that question. Let me give you an example of a water supply system, how we're working with communities. The project in Kasai in Congo, there's a period of about 4 months of where health workers and technicians are going into the village to talk about preparing for the water supply system. There's a survey that's conducted, obviously, but there's also a dialogue with the village leaders and with both informal leaders as well as leaders, which our staff work very closely to find out at the community level what's happening. They're engaged, before the project even starts, they're engaged for 4 to 6 months on dialogue with the village, setting up the village committees. If there isn't a village committee, if it's a rehabilitation, there may be a village committee. So they're setting up village committees. One of the most important part is to have 50% that are women on those committees. You talked about women, and it's wrong that this is the first time we're talking about it. The people who suffer the most from lack of water supply and sanitation are women. It's women that are carrying water. On average, even if you look now with coverage, they're still carrying water for 45 minutes to an hour a day, even with improved systems if you take on average. If they don't have an improved system, they're traveling 2-3 hours. Some of the communities we visited in Congo, the women were traveling about 2 hours, and girls, in the morning and the evening to collect water that then they have to carry a 20-litre container, 15 to 20-litre container on their shoulders back from these villages. So you're right, the impact on girls and women, and then they're not at school when they have to be doing this. So the impact on women is immense. Same on sanitation. The impact on women is immense. So water supply brings great benefits, but the important thing is to engage the women in decision-making as well. Where are water points going to be constructed? Who's going to maintain those systems? One of the most successful initiatives is actually train women to maintain water supply systems. And women are much more committed it's been shown through research, to actually maintaining and looking after those systems and making sure they continue to function. So we shouldn't also get into the stereotype of not thinking that women cannot look after and maintain the systems. And that's pivotal also, that CRS to train caretakers, as many women as training men for caretakers of water supply systems.
Let's take one more brief question. Yes, sir.
I have a statement to make about the appropriateness of this venue being in Marquette. And you're mentioning about the Water Council, potential connection with how to improve global water supply, because now it's noticed to be a global water hub. And the one true example is the president of Marquette, Mike Lavelle. He won an award for humanitarianism last year because he helped a female intern who was visiting from Nigeria at that time at UWM, where he was the chancellor, and heard her story that she would go back and forth 45 minutes and bring water to her family through potentially difficult environments and so forth, and miss school at times just to get that clean water. And through the water counseling he's part of, Dr. Lavelle helped manage the water council members and the industry and active emissions to come to a table and help solve that village's issue to get clean water locally so that girls like her do not have to.
Mm-hmm.
So that's an excellent example of how individuals or institutions and entities or even folks who really want to be involved. I just admire his commitments.
All right, thank you for that statement. I'm going to wrap things up there. Before we say thank you to Ms. Tobin, let me just mention a couple of other on the issues events that are coming up. Always like to look ahead. On Monday at 4 p.m., it's a special time. We'll be talking with Congressman Paul Ryan, the chairman of the House Ways and Means Committee, and former vice presidential candidate. I believe that event is full, and there's a waiting list, so if you haven't signed up, we're sorry about that, but a lot of interest. And then on February 17th at our regular time at 12:15, Paul Taylor, who is a fellow at Pew Research, he's written a pretty interesting book that's called The Next America, and it looks at the, as he calls it, the looming generational showdown between millennials and boomers. And as a boomer, I'm really interested to hear what he has to say about that. And we've got a couple millennials in the room too, so it should be good, and we hope that you'll come. We've got just a few seats for that, another big crowd expected, but we hope you'll join us. Having said that, let me thank you again for your interest today. Thank you for your good questions, your attention, and most of all, let's thank Vanessa Tobin for her good work and for being with us today.
Thank you. Thank you so much, Mike.